Okay. So you told me a great story
Okay.
when I was there. I
I
don't
was
know
like,
if
why
you
am I doing this? I'm like,
so the let me just talk through that real quick. The purpose of this is really to give somebody's perspective that is not a dentist. Okay.
okay,
So the
okay,
purpose is to really give them an idea of what somebody might expect with SmileWizard outside of being a dentist. And
okay.
so the story that you told about like how you got put into or how you got together with Raj and
Yep,
kind of became his office manager and um how you guys sort of took off. I mean, it was around that time, I believe, that he got involved with the Dawson Academy, and you guys were able to really just kind of you start to use the tool, and um,
yeah. And we just
I,
made it our philosophy. And
you
once we
kind of
did
made
that,
it exactly. So that's those are kind of the things that I
okay,
want to capture
okay,
on here. And I've never done one of these outside of a dentist before. And
okay,
so this is kind of a trial
okay, good.
that to do. So, I mean, really, and there's no wrong answers. And also, this will be completely edited from beginning to end before we actually put it out somewhere. Does that make
Okay,
sense?
yeah, yeah,
So, um, if you could, what I'd like you to do is do the perfect intro, which is, um, state your name, state the company that you work for, and what you do, kind of what maybe your office philosophy is. Um, just kind of introduce yourself in the office and kind of what you do in the office.
okay,
And so, just to reiterate that, we're going to edit this out. So you don't even really need to say hi. Just kind of say,
hmm,
my name is, and just kind of go on from there.
okay. My name is Danielle Rubinetti, and I work for Metropolitan Center for Complete Dentistry. I work for Dr. Raj Upadhyaya. And our dental office is different than most offices. We're a Dawson philosophy office where we treat the entire mouth. It's not just one tooth at a time. Um, Bite related issues. We just work on comprehensive dentistry. And I think that's what sets us apart from any other dental office. What else
No,
to
that's
say?
perfect. That was really
Okay.
good. And so let me just ask a quick question. Um, I like the philosophy. Um, so maybe just kind of talk through now, kind of from the start, like how you got involved with Raj, what you were
Okay.
doing. So go ahead.
Okay. I met Dr. Padia 9 years ago. I worked for a practice for 20 years. And I was actually surprised at this whole comprehensive dentistry. I thought I knew everything, having 20 years experience. And he's taught me so much about bite related issues, looking at the entire mouth. Um, I don't know what else to say. I know I'm not being good at this.
That's fine. Take
Um,
your time.
his philosophy is a should I talk about Dawson or you don't want to be attached to Dawson? That's what I don't
No, it's
know.
okay if you talk about Dawson. That's totally fine.
Okay. So Dr. Upadhyaya is a Dawson Academy educator. And I know now I'm getting like all freezing up. I'm sorry. I'm getting like nervous. I don't know why.
Maybe I should just
Um,
ask you shorter questions. I don't know.
Yeah, maybe you should. And then we'll go back to, the same thing happened with the video. I was like, oh, I talk so much all the time, but then put a camera in front of me and I'm like,
Yeah.
hubbada, hubbada, hubbada.
Believe me, I am exactly the same way. Because I do a lot of like just training videos on SmileWizard, and I'm always
Okay.
like, man, I should say that differently or all that. But just no, just um
So I could say, okay, so I work for Dr. Rajupadia, who is a Dawson Academy educator. I didn't know what he was talking about. And he introduced me to this whole philosophy that you don't just treat the one tooth, you find out why. Why are teeth breaking? Why are teeth chipping? Why we have TMJ issues. I literally thought he was crazy. And I said, okay, let's give this a shot. And he makes it standard in our office that every new employee has to come in and go through the records appointment and learn, go through the SmileWizard to learn so I can then educate our patients about our philosophy. So it takes a while to get this launched. He had this great idea that one day he wanted to build a training center and start teaching and let these young doctors know how to tell someone why their teeth are breaking and failing. And, fast forward, we're here 5 years. It's very exciting. And we're helping so many people. He's teaching so many young dentists. I went through the whole process. I understand it now. And it's wonderful to be able to tell a patient why they have a cavity, why they have period disease, why they have bruxism. So to be a dentist out there to just help in that way, it's wonderful. And I think that's what sets us apart from just your any other dentist.
How long has it taken for Dr. Upadhyay to kind of be known for what he's doing?
It took a while. I mean, I'm not going to lie. I'm with him almost 9 years. I would say, I think he's been in the academy 20 years, but he's been teaching for about 5, 6 years, like really teaching. He would do a course here and there. So I would think it took maybe 5 years to be known. Now we're getting referrals from all other dentists for the whole bite issue, TMJ issues. Most of our referrals are from other practitioners.
How did SmileWizard play a role in becoming that type of a dentist?
SmileWizard is just think of it as a master checklist and just step by step by step. Like you don't have to be a Dawson educator or Dawson student or Spear or Pankey. It's for any dentist to sit down and it's just it's very simple, step by step by step. You can't miss anything. And I'll tell you, we were talking about this today. Most of our reviews, we have 5-star reviews, are always after the comprehensive exam. They go, wow. The patients are wowed. It takes about 20 minutes and it's so thorough. And you're seeing the entire mouth. You're not just going, okay. And then you're meeting the dentist and you're talking to him and you're engaging in those 20 minutes. I think every dental office should really, they should use it if you want to take off. It will make you different. And if you look at our reviews, it's always like that. The majority, the new patients, like, wow, they are wowed. And, you're not doing it for that, but you're also educating them. Also, like, this is what's happening with the checklist, which is wonderful. And every single new patient that comes in our office has to go through the SmileWizard.
So when you were with the old office, um, what are the biggest differences do you think in like process or workflow between the two offices?
We were just treating emergencies, new patients. The doctors were going in and doing a 5-minute exam. They're comprehensive exams. They didn't know the patients. It, we were like everybody else, successful. But we used to call it a mom and pop's, dental office, but we weren't different from anyone else. We were good dentists. They were good dentists, but it, it's so hard there's no comparison. There's absolutely no comparison. I'll tell you, in our referrals, like after the comprehensive exam, not only do we get the Google reviews, this is how we get the referrals. we have a dentist right next door to us. And we have people popping in. They're like, your office is so beautiful. I heard so many things, but you don't take, we're a fee for service office. We don't take any insurance. We have people that switch and come over because they hear about the kind of work that we do. So Dr. Apati has a great reputation. I mean, the staff does too. I mean, we really take care of the patient. We take our time. We're not rushing. And in the end, you will be successful.
So we've heard that one of the things that SmileWizard does is it gives the doctor confidence in what he's doing because it's repeatable. Would you say the same thing for the office as a whole? Um,
Yes.
okay.
Yes. It's like planting the seed, and you do the SmileWizard and the hygienist. It's that constant, like, we're all aware of what's going on with all this new technology. We're just all aware of what's going on with one single patient because we have all these tools. Oh, it's amazing. It's amazing. And like I said, I think every dentist should be using it. It's just you just think of it as a master checklist.
Was there any hesitation when you first when Raj introduced it to the office?
Oh yeah. Yeah. Oh, well,
Do you
I
remember
think
what
there's
some of
always
those were?
hesitation with anything new. We don't like
Yeah.
change. When I started with them, my old office, a new patient was an hour, the cleaning, the exam. Now we set apart an hour for the exam with the SmileWizard and then the hygienist. So we're a good hour and a half, almost 2 hours, like your first time here. But it's worth it. It's worth it. So yeah, I think that I keep saying it. It's just a great tool. It's a great tool.
Let's see. Was it difficult? Well, actually, let me ask you this first. Um, when you think about how it's been integrated into your office, maybe talk about how that went. Maybe when you were first learning about it and first starting to use it. I mean, do you remember that time? Was it easy? Was it a little difficult? Does everybody use it?
Everyone, yes. Well, yes. Well, no, well, we have two providers here. Dr. Andre didn't go through the Dawson Academy. He's just starting. Um, but I think Raj has introduced it to him. I'm not sure. But all the new patients go through Raj. I think with anything, it's scary. Change is scary. The assistants push back. So we would schedule a new patient. He would come in, he's like, where's the SmileWizard? And we had to keep pushing. And even me, like when I was scheduling patients, like, he only scheduled me a half hour. I need an hour. He's like, I know it doesn't make sense to you. So there was a little pushback, but it wasn't a long transition because that's what the doctor wants. He wants it, we do it. And now it's just automatic. We don't have to, it's automatic. New
Does
patient
it
gets the wizard. Oh yeah.
does it save time now that you've learned how to use it? It's kind of in the routine. Overall,
Yes.
does it save time?
Yes. Because a comprehensive exam used to be an hour, but Raj can do it in about 20 minutes now doing it. I guess with anything, you just get better at it the more you do it. But oh, absolutely. Absolutely.
Excellent. Since you're so integrated into like what you are charging for the various things that you guys do, how would you say how would you talk about the ROI for SmileWizard itself? Does it pay for itself?
Yes. 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 it You may not see the return, say, immediately, but like I said, you get a referral and then you get a referral and starts branching off. It apps like the whole thing is you want to have a comprehensive exam. You also don't want to miss anything. You also want to be a good practitioner. So these are the tools to make you find if there's perio issues, TMJ issues. these are the tools to just for you to be a better provider. So absolutely, absolutely, it's worth the money.
Did you happen to notice any type of any difference in things that maybe either had to be redone or things that might have been missed?
What do you mean, missed how?
Well, perhaps even when you guys weren't doing the complete exam with the wizard, was there anything missed? And in other words, did you have did it lessen rework in the office? Or maybe dentistry that might have missed something, or does that make sense?
It does make sense. I don't know because I don't know like clinically. That may be like with the assistants and the doctor.
Yeah.
But like I said, it's just making you more thorough. I mean, it's just by taking the time, you're actually looking tooth by tooth by tooth by. I mean, it's amazing. So you have to retrain yourself, obviously, as the doctor,
Hmm.
because, and I don't think this would work for one of those, like Aspen type dental places where it's only 30 minutes. That's not, this isn't what they're about. This is for the doctor that's just starting out, wants to be a little different than the dentist next to them. I, I, I I actually think that everybody should have this. It's just, like I said, it's that master checklist and it's always there in front of you.
And would you attribute um, the reputation that you have now? I mean, I'm sure a lot of it has to do with more comprehensive dentistry and complex cases. Are you guys kind of known for being able to do those types of things?
Yes, and we attribute it to the SmileWizard, to all the steps that we take our time, and that we're going to find out the reason why things are happening, and then we're going to build you a beautiful, functional smile. Absolutely.
Okay. All right. Anything else you think would be interesting to talk about, or as the office manager, let's say you moved to another office for whatever reason, um, how would you go about implementing Smile Wizard there, or would you?
Oh, I would. I would. I would probably just suggest to them, like, I have this great program that you can install and it will help you. It depends on what type of office I go to. I obviously would go to probably like a, you know, not a Aspen type dentist. And then just give them examples of why it works and that the cost will pay for itself because of all the dentistry you find and all the jobs that you're doing correctly too. It's not just about making money. I know it sounds crazy. It's not, it's about helping the patient and doing the right thing. And this gives you the means to find everything. So I would absolutely um, encourage a new office to implement this and to purchase it. Absolutely.
Okay. All right. Thank you so much. I think that's plenty. I
Okay.
think, yeah, we will put together some of these clips and I'll probably end up sending them to you once we have them.
Okay.
But I think that was awesome. You did great.
Oh, oh, okay.
Um, so yeah, we'll cut it and put something together um, and then we'll probably have this out there for people to look at. So,
Okay, perfect. Okay, anytime.
okay. All right. Thank you so much.
Okay, take care.
All right. Bye bye.
Okay, bye-bye.